doctrine of Reps Ipsa Loquitur, that is, the rule of evidence, which in reality belongs to the law of torts. Okay. Ordinarily, the professional negligence of a physician must be proved in the court by the expert evidence of another physician. The patient need not to prove the negligence in case where the rule of res ipsa loquitur applies, which means the thing or fact speak for itself. The patient has to merely state what according to him was the act of negligence, the conditions to be satisfied. That in the absence of the negligence, if there is no absence of negligence, injury would not have occurred. Next, the doctor has exclusive control over the injury producing instrument or treatment. That the patient was not guilty of a contributory negligence. This enables the patient's lawyer prove his case without the medical evidences. Examples. Examples say prescribing an overdose of medicine producing the ill effects, giving poisonous medicine carelessly, failure to give TT injection and it causes injury causing tetanus, the burns from application of a hot water bottle or X-ray from X-ray therapy, the breaking of needles, failure to remove the swabs during operation which led to complications or cause of death, the blood transfusion misadventure, loss of use of hands due to prolonged splinting after a fracture. Application. This doctrine is applied to both civil and criminal negligence, and it depends upon the nature of the incident causes that the negligence. Next is it does not apply where the common knowledge or experience is not sufficiently extensive to know that the patient's condition which have not existed but for the doctor's negligence. Even without the next is it cannot be applied. It cannot be applied where the applied against several. There are several defendants. Only one whom cannot be identified, which have caused the patient's injury. There are so many multiple defendants, but we cannot identify who is that do this wrong thing. So it is not applied. This doctrine is rarely used successfully by patient because a patient's conditions this patient's condition has caused even occurs without a doctor's negligence, and it should be a common patient condition will not have existed for the. It does not apply where common knowledge or experience is not sufficiently not to know that the patient's condition which should not have existed but for the patient's doctor's negligence. This is Reps Ipsa Loquitur doctrine. Thank you.